Jan Herdman, and today I'm speaking with Dr. Manoj Kumar, who is the Head of Plastic Surgery at the Getwell Soundarya, as well as Head of Plastic Surgery at Max Healthcare, Delhi. Welcome and thank you very much for joining me.
Thank you.
And I know I've just taken you out of, or grabbed you after theatre. You've been doing a liposuction, I understand.
Yeah, it's a pretty strenuous job and I've just finished it. And, I'm so happy to talk to you.
Lovely. Tell me, that's just one of the processes that you do. What else do you do?
Well, we are offering all kind of cosmetic anesthetic surgical services here in Getwell Soundarya. Right from rhinoplasty, all kind of breast reductions, breast augmentations, liposuction as I just have done. And then there are several other things like male gynecomastia and things like that.
Okay. And I also understand that there's something called an automated hair transplant as well?
Yeah, that is called SAFER. The full form of SAFER is suction assisted follicular extraction and replantation. So what it all means is that we've got a robotic machine by which we can take out, and of course this is used for hair transplant, and it's a revolutionary new technology whereby we can remove a large number of hair follicles without giving a scar, which happens in the typical micro hair transplant cases.
Is that done one follicle at a time, or is it a strip?
Yeah, we take one follicle at a time, and because this robotic machine basically takes away one follicle at a time, and it does it very, very fast. So in expert hand, we can get up to 3,000 hair grafts in say 3-4 hours, which is pretty phenomenal. And then we have got the system to replant it at the place where we have to put it.
So how does that compare to what they used to do with hair transplant before?
The conventional technique for micro hair transplant is by what we call strip method. We actually take out a long strip of skin from the back of the patient, where the hair are supposed to be genetically programmed to last for the longest period.
Oh, is that right?
Yeah. You find it born, will have a little hair between the 2 years. So that's true.
Yeah.
They are genetically programmed, and what we do is we make those hair follicles full. We full them. We put them in the front of your scalp, and they continue to grow in the same way as they would grow at the original site, because they think they're growing there only.
That's amazing. Very
important and very good point that when we do a hair transplant, the transplanted hair stays stays forever. It doesn't go. I mean, even if the person has a tendency to lose hair, the hair originally there, they're supposed to be lost. They can be lost, but these transplanted hair will stay there forever.
So, what's the procedure? Do you anesthetize the area?
Yes. We give some local anesthetic. It's a very simple anesthetic, local anesthetic procedure. There's no need to put any general anesthesia or any sedation also. So we just give a local anesthesia. We call it regional anesthesia. Basically, we block the nerve supplying that part of the scalp, so that area becomes completely numb. And then, with the help of this robotic machine, we take out the hair follicles. And as I told, that in expert hand, it can be really very fast. And then there is a technique by which we make a fresh hole at the area where the graft is transplanted, and again the same machine is used to put them in right position.
Okay, so you take the follicles out one by one, and then do you straight away put them?
Taking it out one by one, and it's all getting collected somewhere. And at the end, when we know that we have had sufficient number of hair grafts, we just take the receptacle. We have got the whole lot of hair follicles with us, and then we replace it at the new place. Again, the same machine is used. It just fixes the hair follicle and then bang, it's in.
Unbelievable. So it doesn't leave a scar or anything like that?
It doesn't leave any scar at all. And not only scar, because when you do the standard hair strip, it divides the nerves, and the certain area of scalp remains numb for whole of the life. Also the fact that there's a huge scar in the back of the scalp, although it is supposed to be covered by hair, but still scar is a scar. It can cause a little problem. So here, there's no scar at all.
Okay. Bleeding?
Bleeding is negligible, close to nothing. So that's one of the good news, because they are very, very fine, punches through which we take out this. There's no bleeding at all on this. Okay,
so if you took the standard receding hairline, that's the nicest way I can put it, I think. How many follicles would you need to create an effective full head of hair?
That totally depends on the area that needs to be grafted. See, we would like to do this surgery on a small or medium loss of hair.
Okay.
The reason being that donor area is limited. So in one strip technique, in one strip, you are able to take, say, between 1500 to 2000 hair grafts. So we are limited by that. So if we spread that in a big area, then obviously it's not going to give a normal look.
Sure.
Whereas if there is a small to medium area, then we can give a very high density, which will look real normal. Here also, Safer comes to your rescue, because when you use Safer, the donor area is the whole of the scalp, not just a strip.
Of course.
So
Yes.
you can keep harvesting till your number of hair follicles that require.
Okay, so they get the thickness that they're after, yeah?
So the answer to your question as to how many grafts are required, it totally depends on the area that needs to be transplanted.
Is there an age group at all, or is it just
Not at all.
really?
Not at all.
Yeah.
I've done on, say, 70-year-old men as well.
Is that right?
If you wish it and you think that is going to help you cope up with your life better and you will find happiness in that, any age is no bad.
No, you said men. Do women have this done as well?
Oh yes, it does happen, although much rarer.
Yeah.
And it has something to do with the estrogen, because estrogen is supposed to give hair a better longevity. But then yes, sometimes ladies come, they have got a different kind of hair loss. They usually have got thinning of the frontal hair. We call it vault of skull. Over this area, sometimes they have a thinning of hair, and the hairs are there, but they are much sparse.
Sure.
So the scalp is visible through them.
Yeah.
And in them, we can easily increase the density by hair transplant.
Amazing, isn't it?
Yeah.
Really. And one last question: is it expensive?
Well, it is an expensive procedure. It's a pure cosmetic procedure. It's done as per your wish, and it's expensive. And especially when you do by Safer, it's a high-tech, expensive equipment. So cost goes up again.
Okay, can you give me an idea of the cost?
Yeah, well, for a strip method, typically we are charging between 20 to 40 dirhams per hair transplant. It goes, say, up to 50 to 60 if we use robotic. But again, it depends on how many hair of transplants are used. We are really flexible about it. Somebody who needs, say, 3,000 or 4,000 hair transplants, we ask them to pay 60 dirham per annum, it will be too much. So we try to give them a little bit of, but of course it's on the higher side.
Okay, well that's lovely. Thank you very much for joining me. I will let you go and change after your surgery, and hopefully I'll catch up with you again.
Sure, thank you so much.
Thank you very much for joining me. This is Jan Herdman on Aesthetic News, and we'll see you next time.